Hello everyone, my name is Tiara Brooks from School-Based Health Alliance, and we would like to thank everyone for attending today's webinar titled Children's Health and Education Mapping Tool 201 Training. The objective of this webinar is to provide advanced examples for users, including how to upload your own data. We hope that you find this training very helpful. But before we get started, we have a few housekeeping reminders. If you are viewing as a group, please go to the chat window in the question box and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the question box located in your GoToWebinar control window. We will address questions following the presentation. Attendees will be asked to complete an evaluation poll questions at the end of this webinar. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that will meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archive webinars for such topics as the ones that you are viewing on your screen. I would now like to introduce our presenter today, Ms. Erin Scheller. Erin Scheller is the Research and Evaluation Manager at the School-Based Health Alliance. Erin earned her Master of Public Health degree from the Johns Hopkins Bloomberg School of Public Health, focusing on professional epidemiology, program planning, and evaluation. She has an undergraduate degree in anthropology from Washington University in St. Louis. Erin has a background in maternal and child and reproductive health, including work with Child Trends, the San Francisco Department of Public Health, and United States Agency for the International Development. As a nurse trained at the University of Pennsylvania, she has on-the-ground experience with a variety of patient populations, domestically and internationally. I would now like to welcome our presenter, Erin Scheller.
Thank you for the introduction, Tiara. Let me just pull up the mapping tool. So good afternoon, everyone. Welcome to our advanced user training on the Children's Health and Education Mapping Tool. This training focuses on how to upload your own data and use some of the more advanced features of the mapping tool. So it's most appropriate for those who have attended or watched a previous introductory training. I'll be focusing on an oral health example in honor of Children's Oral Health Month this February. We'll save lots of time for questions at the end, both about this demonstration and about any general questions you might have about the tool or any of the introductory training. So as a quick overview, as you all know, the Children's Health and Education Mapping Tool builds on the power of geographic information systems technology for data-driven decision-making for those interested in chronic inequities among low-income children and the social determinants of health. The tool can be used to assess community child and adolescent health, identify areas of need and target new services, examine characteristics of schools and SBHCs, collaborate with and learn from local peers, raise awareness to policymakers, and fundraise with effective data and visuals. As a brief review, there are 3 main layers in the mapping tool. The first is the Child Health and Education Indicators that allows you to select any state or the whole country and search, map, compare, download, and print county-level data on child health, education, and socioeconomic status indicators. The second is the SBHCs and school characteristics layer that allows you to map the locations of, filter, and view key characteristics of public schools and SBHCs. The third is the base maps and optional layers, which among other functions allows you to add the locations of hospitals, FQHCs and lookalikes, or rural health clinics, as well as areas that meet the criteria of being medically underserved or health professional shortage areas. For our oral health example, I'll tell you that tooth decay is the most prevalent and preventable chronic disease of children in the U.S., and lower income and minority children experience higher than average rates. Because of this, we at the Alliance, along with many of our other partners, see the incorporation of oral health into schools as a health equity issue and one that is pressing. For this scenario, we'll imagine that we are California state public health analysts interested in improving children's oral health. First, we're interested in learning about oral health generally across the state. Are there areas that do not have a sufficient number of oral health providers? To find that out, I can look in my base maps and optional layers, and I see that we have data for health professional shortage areas for dental health. Dental health professional shortage areas are based on a dentist to population ratio of 1 dentist per 5,000 residents. Here we can see that California actually is doing pretty well and has few dental shortage areas. Next, you know that there are no dental or oral health data in the child health and education indicators layer because surveillance for oral health needs could be vastly improved. But you know that there is some dental health data in the California Health Interview Survey that's available by county. Here's some data that I downloaded from the 2014 California Health Interview Survey. I can see a number of different children's oral health variables, but I can also see that it looks like the most data that are available are for whether or not a child who's insured has seen a dentist in the last 6 months. I can see that this data is available for nearly all of the counties across California. So I'm going to upload this to the tool using Map My Communities data. I can find this layer under Tools, Map My Communities data. This tool is the same as UDF Mapper's Quick Themes tool. So you will see some links to their training sources on this function on our website. Here you can see some basic instructions, and we'll see that we need to create a data table in Excel and then paste it here into Map My Communities data. You can upload data either at the state, county, census tract, ZICTA, which stands for Zip Code Tabulation Area and is created by the Census Bureau, or PUMA, which is a public use microdata area. So as you remember, our data is available at the county level. We'll need to create a standardized table in order for the mapping tool to read all of the data that we want to upload here. We can see that this first column has the name of each of the counties that I'm interested in, and it's a text variable, so they're all spelled out. In order for the software to correctly read all of these different geographies and the data that I want to upload, which as a reminder is in this column D, I need to enter the counties as a numeric variable. So I will have to upload it as a ZICTA. By looking online, I found this file from the U.S. Census Bureau that tells me the different ZICTA and FIPS codes for different counties. So here I can see that my state is a 2-digit abbreviation. And then the next part of this file tells me that the county is a 3-digit number. So here I'll just search to find California. And now I can see the codes for everything in California that I'm going to want to upload to my table. So coming back to my table, I set up each of these cells so that you can see the 06 for California and the corresponding 3-digit code for each county. The other columns in my table include the state, the data that I will want to be coding on and uploading, and I've also chosen to include the data source so I can remember that. My next step will be to copy all of this information that I'm interested in uploading to the tool. I'll select it all and press Control-C. And when I go back to the mapping tool, I'm going to press click here to begin. And as you can see, I'm going to hit Command-V to paste my data into Quick Themes. Now I need to tell the program where it can find my data. So over here I see select the geography type and fifth or abbreviation column. My data are in county format, so I'm going to select county. And where it says ID, I'm going to tell it the name of the column that I want to pull data from in my Excel table. So that's from the county FIPS code. I also want to fill out some of this other information. Here it asks me if any of the columns represent a title. So I'm going to choose the county column that's actual text. For group category, this is how it will upload and sort the data that I want to show. So here I'm going to put my 6 months or less since the last dental visit. When I scroll down, as many of you might remember, in the other layers, you can hover over a school-based health center or county and see a pop-up that tells you some additional information. So this will function in much the same way. I can select here what additional information I want to show in a pop-up box when I hover over some of these things. So here I'm going to choose to show county. It's also going to show the state. It will already show my data point, and I'll have it show the data source. My next step is just to hit load. Here I can see all of my data have been uploaded to the tool, and I can see across different counties some of the different values for the 6 months or less since a child has last been to the dentist. Here in the legend, I can see how it's categorized my data. I also have some control over this, and I could choose instead, for example, to see only 4 different categories, and we can see here that that will shift some of the values. I can also choose how I want the data distributed. For example, now it's in quantiles, but if I want an equal number on each category, I can select equal interval. I'm going to choose to stay with quantile. Here I also have the option to change some of the shading. So for example, if I wanted to see more red options. So this map is now telling me that some of these counties that are in the darkest colors have children that have been to the dentist most recently. So the lighter colored counties are ones where children have been to the dentist less recently. As you kind of were able to see, when I hover over one of these counties now, I can see the name of the county, the data value that we uploaded. I can also see the state and the column where I included data source, which was the 2014 California Health Interview Survey. So I can see that generally children in California have been to the dentist fairly recently, but it looks like around LA perhaps a little bit less recently. I'm going to go ahead and remove the Map My Communities data layer. Now that I've identified some general information about dental health in California, I want to find some more out about a community where they're working hard to address challenges to children's oral health. LA Trust, a nonprofit affiliated with the LA Unified School District, has been working on oral health as part of their mission to improve student health and well-being in LA schools. LAUSD students miss about 2 days of school per year on average due to dental pain. And LA Trust's long-term aim is to decrease absenteeism and secondary dental disease, saving thousands of missed school days. Partnering with grassroots and other educational organizations, LA Trust continues to raise awareness about the importance of oral health and brings much-needed resources to high-need communities. We applaud their hard work and appreciate them sharing their data with us for this example. LA Trust is a DentaQuest grantee to bring together stakeholders in LA County and our partner in expanding oral health services to the 10 largest school districts. As part of our asset and needs assessment of the community in LA, we want to map where services are currently being provided in schools. Now I'm going to go to Tools and Map My Data Point to upload some specific information about where oral health services are being provided in schools. Similar to the Map My Communities data point, Map My Communities data, this corresponds to UDS Mapper and Health Landscape's Quick Geocodes tool. and requires data to be formatted in a specific way. So to use Map My Data Point, which allows you to upload address data, you'll need to create a spreadsheet with separate column headings for street address, city, state, and zip. You can include a row for each location that you want to be included on your map. You can also include other columns with any additional data that you might want to show in a tooltip or pop-up box, like we did on the last map, or to categorize your data. Here I'll include the name of the oral health provider, the school that they're providing oral health services at. These are the standard columns that I need, including address, city, state, and zip. I also have information about the school size, the total number of students seen since the oral health program began at the school, the number of unique patients seen since the program began, whether students had not been to the dentist in the last 6 months, those with active dental disease, and the percent of students who needed emergency dental care. So similar to Map My Communities data, I'm going to select all of these columns of data from my spreadsheet that I want to upload to the tool. Then I'm going to hit Control-C to copy it. And I will go back to the tool and select Click Here to begin, and Control-V to paste the data from my table. Here I can see that it's all pasted in the same format as I had in my Excel file. Again, I'll need to tell it where to find the data. The easiest way to do this is to make all of your column headers match. So here I have address for address, city for the city data, state, and zip. Again, I have the option to tell it whether any of the columns represent a title that I would want to have for the pop-up or tooltip box. So I'm going to choose Oral Health Provider as the title. I also want to group the different data points that I've uploaded based on the number of unique students seen since the program began, so I can see which are reaching the most students. I know that Oral Health Provider will already be shown in the tooltip box since it's the title, so I'll also select the name of the school, address, city, state, and zip, as well as the total school population, the total number of students seen, including repeat visitors, those who haven't been to a dentist in the last 6 months, the percent with active dental disease, and emergency care. Now I can just hit Geocode Now, and we see that it's populated these points all in Los Angeles. So I'll go ahead and zoom in. I can do this either using the scroll bar here, or I can select Shift and draw a rectangle around the area that I want to zoom in on. So I can see here all of the different data points that were uploaded. When I hover over a particular site, I can see the name of the dental health provider, all of the information that I chose to upload to my tooltip box as well. Here in the legend, we see that the data have been categorized based on the size of the program and the number of unique student visitors. Again, I'm able to change this. So for example, I might want to see only 3 different categories because I don't have that many different programs. I could also choose to make these points larger so that it will be easier for me to find them on the map. We can see that some great work is being done in certain regions of LA around oral health. But if I add on the public schools, that will help me to see whether there's still room to continue expanding these services. See that there's a lot of schools in the region, and we know that underserved children are least likely to be getting oral health services that they need. So I'll also choose to look only at Title I eligible schools, and perhaps schools where there's a significant portion of the population who are eligible for free or reduced lunch. As a reminder, you can either use your mouse to move these bars or the arrows on your keypad. So now we can see that there are some neighborhoods in Los Angeles that look like they might be especially good locations to target for expanded oral health services to students in these schools. So in order to upload data and share or save the map that you want to return to later, you will need to create a login. You can do that down here and log in an account settings. I'll go ahead and enter my information. Registration is free, and we will not share your email or anything like that. But if I come back to map my data point, now I can see that I have the option to save this as a new ID, and I see that I can save 3 more. So I will go ahead and you just enter a name so that you will know how to save it. So I'll save this as LAUSD Oral Health Data. This way, next time I come back to the tool and log in, I'll be able to see the data that I've previously uploaded. And that is a function that Health Landscape is currently updating for us. So if you have any questions, you can reach out to us at research@sbhforall.org if you don't see it right away today. And as a reminder, you can definitely print the map with everything that you've uploaded here. And I'm happy to take any questions that you all have. Thank you all for your time. I know that was a brief example, but we were hoping that you would have many questions. We know that's a lot of information to go through, so I'm happy to go back through anything if it was a little bit unclear. And we'll be hosting this webinar to our website.
All right, while we give everyone an opportunity to enter their questions, we do want to take a moment to mention the membership with School-Based Health Alliance. School-Based Health Alliance is able to provide technical assistance and training. In addition to supporting our mission, members receive many benefits, including discounts on professional services, products, letters of support for grants, newsletters, and more. To learn more and to become a member, please visit School-Based Health Alliance at sbhforall.org/membership. Again, if you have any questions, please enter your questions in the questions box.
We did have a question about the number of different data sets that you would be able to upload. So currently, you're able to upload 1 set of data to map my data point and 1 set of data to map my community's data. So you can include a certain, I think, 500 records in each of them. And as a reminder, the difference between the two, Map My Data Point allows you to upload address-specific data. So in our example, we uploaded data about schools that have oral health services, and then we were able to sort them based on the size of their program. For Map My Communities data, you're able to upload aggregate data that's at a level such as the county, zip code, state, census tract, or PUMA level. And there's also a question about registration and login. So you don't have to register to use the tool. The tool is still free, and users do not have to register unless you're choosing to save your data so that you can come back to it later. As you're all thinking about potential questions, we'd also love to hear any feedback you might have on how you can use this tool to upload your data. If you have any projects that you're thinking about that this might be helpful for you in planning or analyzing or thinking about. We'd also love to know if anyone has already tried uploading their own data and hear how your experience was with that.
All right, in case anyone is unable to maybe locate, open it up on the speak or say anything. And if you are not interested, and you can just mute your line, but we would like to give everyone the opportunity to speak if they have any questions. You are now unmuted unless you muted yourself. All right, we'd like to thank Erin for this presentation, and we still want to give everyone the opportunity. If you do have any questions, please, you can send the questions to research@sbhforall.org, or you can submit your questions still online. The chat box is still open. Right now, we would like to give everyone an opportunity, if you can please help us to just answer a few poll questions. The first poll question we have is, does this presentation meet your needs? All right, if you can just please answer yes or no.
And as you're thinking about your responses to these questions, if you don't have a specific question right now but have an additional topic that you'd like covered in a future training, we would love to hear about that as well so that we can best meet your needs.
And we'd also like to ask, how well did the presentation meet the stated objectives? If you can please take a few moments to answer this question. All right, thank you, everyone. Our next question is, how likely are you to apply this information? If you can please answer the question. Thank you, everyone. And our final question is, would you recommend this webinar to others? If you can please take a few moments to answer the question. Thank you, everyone.
So thank you again for joining today. I'll stay on for 5 minutes or so if anyone wants to chat, or I think that you're all still unmuted as well. If you have any questions or want to discuss any ideas that you have for how you can use the tool to upload and have any additional TA needs. And we're happy for you to reach out to us in the future. And thank you again for your time and interest.